here to talk to you about what's happening on Capitol Hill. And I'm sure you're aware, one of the big things that Congress is currently thinking about and working on is healthcare, what to do with the Affordable Care Act. And I can't tell you whether it's going to actually happen or not, but one of the things that they are considering as part of redoing the Affordable Care Act is greatly expanding health savings accounts, doubling the limits for families that are covered by a high deductible plan. And for a lot of you that are either have high deductible plans or are considering moving to high deductible plans with a company, HSA or HRA, you need to be thinking about how that may impact your 401k and how people may be thinking about changing their contribution decisions when it comes to having both a 401k and an HSA, because HSAs have even better benefits than 401ks in the sense that not only is it tax deductible like a 401k and tax deferred, but if it's used for qualified medical expenses, it's going to be tax free. And they are expanding the definition of what's qualified medical under this proposal to include over-the-counter drugs and preventative health services. So in terms of how employees will be looking at things, they may be first saving to the out-of-pocket costs in the high deductible plan. Let's say that's $3,000. Then they'll switch back to the 401k and try to take advantage of the match that you're providing. But then after that, if there's no match, frankly, for a lot of employees, their first choice is going to be to go back to the HSA, where they have the potential of tax-free savings, and then if there's anything else left over, to go to the 401k. And so something you need to be thinking about, particularly if you're considering a high deductible plan, if they expand HSAs, they become sort of another kind of retirement vehicle for medical expenses, and the interaction between that and the 401k are going to be big things that your employer as well as your employees are going to be thinking about.